Welcome back. Corewell Health says communicating with the health system is about to get a whole lot easier. They've got a new text message system launching 1 week from today. And Jason Joseph, the Chief Digital and Information Officer with Corewell Health, joins us now live to tell us all about this new program. Thanks so much for waking up with us, Jason.
You bet. Thanks for having me.
Absolutely. Tell us all about this new system and how it works.
Yeah, so we've had text messaging reminders, as many organizations have, for quite a while. This is really a new set of technology that allows a little bit of two-way communication, so you can actually chat back on some of these things, allows some personalization, so you can decide which types of messages you'd like to receive or not receive, has different capabilities in terms of different languages that people can speak. We can help enroll your family and can control a lot of this through our MyChart app, which allows more flexibility and more interaction. And over time, we're going to expand that functionality and add even more features to it.
All right, really cool to hear some of those details. And I was wondering about that. I know there are some healthcare systems that use MyChart, and this, really kind of already makes it easier, kind of feeling like you're getting that one-on-one communication with some of your healthcare personnel. This will really sort of expand upon that, it sounds like, Jason?
It is, yeah. MyChart's an amazing way for patients and their families to just interact with their healthcare, and we've had that in place for quite a while. This just takes it to a new level, allows more interactivity and the ability to kind of interact via that familiar text messaging interface that so many are used to, instead of having to necessarily go into the app or onto a browser to access it.
That's a great point, because for some people, yeah, that could make it more challenging having to go through those different loops, as you said, if you've got to download an app or go to a website versus sort of just communicating straight through the text messages. So kind of explain more how it works and which services you'll be able to access with this. I understand it's supposed to make it easier for patients to confirm, reschedule appointments, pay bills, receive health messages, more. How exactly will it work?
You got it. That's exactly it. So you'll get reminders for appointments. You can say, yes, I'm going to confirm that. You can say, no, I'd like to reschedule it, and it will give you some options on that. Bill pay is the same type of thing where you can chat back and forth. There'll be kind of two different numbers that this will come from. One that'll be about a lot of your balance changes, reminders and things like that. And then one for some of your health alerts and reminders as well. And so we're just hoping that over time, patients will get used to this. It'll be a more simple way for them to interact with Corewell Health and their provider. And as we add even more capabilities, this will just be one of those channels that people can take advantage of in order to interact and take more of their health into their own hands with self-service tools.
For sure. That too is good to know, that you're saying it really should just be two different numbers that these messages will come from. So essentially people could even save that number into their phone as Corewell Health. So anytime they're getting those messages in, really just one of two numbers, you'll know that that message is coming from Corewell Health.
Correct. And then when when you can chat back with that, it'll actually be an automated capability. So the system will actually be able to chat with you and let you know what else you can do with that information as well, which is great.
Yeah, well,
And of
Jason,
course,
that was
still have the ability to do all that stuff in their MyChart account as well.
Yeah, absolutely. Sorry to cut you off there, but that was going to be my next question. I think some people will hear that this is all automated and think, oh, goodness, another robot that I'm communicating with. Is this really going to be helpful to me with what can already be sort of a challenging process when you're getting through healthcare and appointments and all that good stuff?
Yeah, certainly there are some care journeys that are much more complex, that are much more involved. And for those, we'll still use people to make phone calls and do a higher level of coordination. But for those more simple things where you've already got an appointment scheduled, or you need to update something, or you've got a bill that just needs payment that's already saved on your account, this is a really easy, quick way to interact and get those things done with Corewell Health as your health plan.
Excellent. So, Jason, next week is the day. It's 1 week from today that it launches, right? So can you kind of explain how that will change the process for patients, particularly that day, 1 week from today? Will there be a change in how they're able to communicate starting then?
Absolutely. It's for a lot of patients, there's nothing to do. They're already getting those reminders. They'll get the new reminders. Of course, they can enroll in this through their MyChart account. They can actually see at the registration time, they can sign up for these alerts and reminders if they don't have them already. But there's really, it's a very easy way for patients to get this new capability. It shouldn't require a whole lot of effort from them. If they're already getting those notifications, they'll just get the new ones. And so many patients may not even notice a difference. They're still going to get that same information. They'll just notice that it's a little bit more friendly, that there's more things they can do when they get those reminders and alerts, and they can take action directly from the text messaging instead of having to log into that.
Awesome. Well, Jason, I think we just have a few minutes left. If you could just speak to people who are maybe needing to make an appointment right now, but are feeling intimidated by the healthcare system, can you speak to them in terms of the steps that it takes to get yourself started so that you can stay on track of your health?
Absolutely. So, of course, we always have available our phone numbers, and those are available online. If you go to our website, corewellhealth.org, you can find all those services there. You can also schedule many of the services, not all, but many of those services are schedulable online as well. And you can just kind of click that. You can search for a provider, you can search for a service. And if that's available to be scheduled online, that'll show up right on our website or again in our MyChart app if you're already a patient and have an account. So the steps are pretty straightforward for those services that can be scheduled. Sometimes if it's a specialty appointment or if there's something more complicated, we're going to want somebody to walk through that with you, and that's still available. And they will either call you if that's an appointment that your doctor has referred you to, or if it's something that is more complex, you'll get a phone call, or we have options to have you call in for that as well. But what we're trying to do is make it just as easy as we can and simple for our patients and for their families to interact and get the care that they need without a whole lot of extra steps, and make that as painless as it can possibly be for them.
All right, we love easy. Jason, thank you so much for your time this morning. Appreciate you joining us live.
Absolutely. Thank you for having me.